Hello, Dr. James Bogash, publisher of Modern Health Myths. Today we're going to talk a little bit about another thing that seems to irk me, where we want to look at these isolated cases of bad things that happen with COVID, whether it's one person didn't develop antibodies or another person um, had the virus took them 3 months to recover from and they're still fighting it, or somebody permanent lung damage, all of these things that occur in a small proportion of people when the vast majority of people recover without sequela or consequences. This is another one. This particular study looked at a small group. It was 18 brains that they looked at of patients who had died of COVID and actually had neurologic symptoms in the hospital, whether those would be seizures, headaches, whatever. And they were primarily looking to see if COVID, if the virus was present in the brain and if it was causing brain damage. Because we hear about all these multi-organ system dysfunction with COVID, and that starts to scare people more because they think that this virus is attacking every single organ that we have. But most of what we're finding, we can narrow things down to two. Is first of all, the increased clotting. That seems to be pretty clear with COVID infections, and we seem to be early on treating patients with anticoagulants, which seems to be better, producing better outcomes. And then the hypoxia, so running out of oxygen. So sure enough, when they looked at these autopsies of the brain, there was no evidence of actual viral infection. It was all damage from hypoxia, essentially, from running out of oxygen, whether it was from the small clots or just not having enough oxygen running through the bloodstream. But the virus did not have a direct impact on the brain itself. It was all the secondary effects of that. And that's what we're finding, other than the lungs. Most of everything that we're seeing is not easily, but an explained side effect of the infection and not a problem directly caused by the virus. So again, just wanted to put that out there and letting you know that this virus is not attacking every tissue that we have in the body. The COVID toes, if you remember that from a while back, that's been debunked, but people are panicking about that for a while. So most of these things when we look at, when we're able to look at through the lens of hindsight, we find that they are, while tragic, they are the indirect effect of the virus rather than a direct effect of the virus. And as always, I will post the link to this particular study in the comment section, and feel free to like this video, share it with somebody who you think needs the information, and subscribe to the channel.